Hello and welcome to today's webinar regarding Trios Practice Lab and the DWX-4W. I'm Dwight Blair, Dental Product Manager here at Roland DGA, and I have with me Frances Torres from 3Shape. She is the trainer of the Practice Lab solution. And Frances has come from far, actually, over for the East Coast side of the country. And Frances, thank you for joining us today. How's everything going?
Great. Thank you so much for having me. It's a treat, especially with California weather. New Jersey is pretty cold right now. So.
Yes. If you would have came last week, you would have caught some rain, but glad you're here. Now, Frances, I know 3Shape itself actually creates software for the laboratory, and they have an intraoral scanner for the clinic, but with CAD/CAM, how do you see CAD/CAM moving into the market now that you've been training a few people?
So I don't know if our viewers know, but 3Shape started in the hearing industry. And what I've seen so far having success coming with our scanners in the laboratory and clinician side, that we see that CAD/CAM is going to be something that's going to revolutionize the way that the dental field is going to. Really?
And that brings us to a couple of things we're going to discuss today. Hopefully you can see it on your screen. And we're going to discuss a little bit about CAD/CAM technology and how it's kind of evolved from that analog system to a more CAD/CAM based restoration production process. We're going to discuss the benefits of same-day, next-day dentistry, which is something we hear in the market today. And that's simply having the patient in your chair and making a final restoration the same day they're in your office and getting them out the door. And we're going to overview the Trios Practice Lab software and talk about a few of the features that are there, easy automated features that will help you get through the workflow quickly. And we'll show you a live workflow today as well. We're going to have Frances go through the software and present everything and show you just how easy it is to use this seamless solution. Hope you guys are ready. I'm excited. I'm sure you are as well.
Yes, I am.
So just a bit about CAD/CAM. Full contour crown and bridge units account for 79% of all CAD/CAM restorations. And CAD/CAM all-ceramic production is expected to grow in 9.2% in 2017. Now what we're saying is, as the market is continuing to evolve, CAD/CAM is starting to produce more and more of the restorations, and we're leaning away from that analog-based system of doing things by hand, but we're still getting real good quality results. And of course, that leads us to more advanced applications. So we do have crown and bridges, 1 to 3 unit bridges, or should I say 2 to 3 unit bridges and long span bridges. And you have the options of also surgical guides, and as implants become more and more the accepted medium for treating patients, you see implant abutments, and we start to lean towards advanced applications. But the technology starts to grow as well. And as the technology grows, that gives you, the dentist, a chance to mill your own restorations in-house with a seamless solution with Practice Lab, of course, and the DWX-4W. So, Frances, tell us a little bit about the benefits of same-day, next-day dentistry.
Absolutely, and thank you so much for that question. So we know that for clinicians, back-to-back patient appointments are super important. And the fact that you reduce the need for provisional restorations once you start, they can use this as a marketing tool to make sure that they have success in getting their patients back. As we know, when you first start with provisionals, you'll have to get your patient back in a week or so. This way, sometimes you get your patients that don't come back as quickly as you want. But the fact that you can use CAD/CAM to make everything a same-day solution really helps the dentist a lot in his practice.
So you have patients, normally you schedule them a week out, you give them a temporary, let the gingival heal, but really that's just for the laboratory to make the restoration and give you enough time to reschedule the patient. Sometimes that's 2 weeks out. But if you create good temporaries, of course, the patient might not come back. They might be happy with their teeth, and you kind of lose a little bit of business there. Of course, the need for provisional restorations, if you have the ability to make it in-house, correct, you can pretty much make your final restoration and skip that provisional process. Reduced shipping costs and rush fees is something that you normally encounter when you're trying to rush a case for a patient that needs the case by tomorrow or 3 days later, and you don't want to wait for that lab time. Sometimes you have to pay the additional rush fees per unit that could equate to $50 a unit or more, and plus you have to cover those shipping costs with each case you send out. And making remake cases without traditional impressions. Basically, when your patient goes out and let's say they chip that crown, and they have to come back. Now you have to re-impress, take a new impression or a new scan, send that back to the laboratory, wait a couple of days. Now you have, with 3Shape, the file on your system so you can download it, print it out right when you're in the office. And last but not least, the technology today is the same as the technology your laboratory is using. So it's tried, it's trusted, it already works, and now it's available for you chairside. So with Trio's Practice Lab, there's a few ways you can actually set up your practice with the software and the milling solution as well as the scan. Francis, why don't you tell us a little bit about that today?
Well, the greatest thing about the software and the way that it works is that you don't just have the ability to use one PC to run your trios, unless that's something you choose to use. You can use your Trio scanner within your operatory, and then if you want your assistant to have the design portion be done in another part of your clinic, you do have that seamless solution available to you.
Oh, really? So, of course, the doctor in this picture you see on the left, he's scanning the patient. He's about to take a scan. He has a choice of pretty much using that same setup to design, or he can have someone else in his office, for instance, a dental assistant. If he doesn't have a in-house laboratory, should I say, they can actually design the crown and mill it. Or you can still send that case, of course, to the laboratory, all within the same software.
Absolutely.
So he can do those 1 to 3 unit restorations in and pretty much send out that extra heavy, more should I say, technical expertise work to the lab and let them continue to work with them, correct?
That is correct.
And of course, that brings us to the scan, design, mill portion of the software. Tell us a little bit how a doctor would actually, or a dentist would set this up.
Of course. So as we see here, the dentist can use the software exactly how he's used to sending something to the lab. And you still have that focus base. So if you want to send to the laboratory, you would set up your order form and then just send it to your lab of use. But you also have the order form set up. Once you do that, you can go in to scanning your full upper and lower arch and your bite restoration. And then from there, just click on next to do your design and click produce and go straight to your mill.
So I know with that, of course, there's the HIPAA compliance issues, and sometimes dentists don't want to send their information. They feel like that's going to be a part of the file, but 3Shape has a software that's HIPAA compliant, and you don't have to worry about any of that information being disclosed to the laboratory, correct?
Exactly. So we have a cloud-based connection. It's called 3Shape Communicate. You would use that to send to your laboratory. I like to joke around and say that it's a little bit like Facebook. You want to have that connection with your lab and make sure that the information that you're sending over is safe. And then it's a cloud-based connection that you would connect with your lab and just send your case on over so they can produce your restoration.
Right. So a laboratory would get a case, but in this case, of course, we're talking about bringing this technology into the practice. Now you have the choice of doing both. So once you finish your scanning and setting up your patient information, you're sending it to another portion of your actual office. And that leads us into the design aspects of things. And of course, when we talk about design, and especially for dentists and assistants, this is a hands-off topic. You usually don't get into this. When cases go to the laboratory, they take care of it. But what 3Shape has done is they've created a software that is very easy to use, user intuitive, and a lot of automated features that will take care of the process for you. And of course, margin design is one thing that you've improved upon, correct?
Absolutely. So there's a few options that you have available within the software. When you go in to take your margin, you have automatic tools that can shape around the silhouette of the margin just by clicking in one specific area. Then what the software does is that it calculates that information and then finishes off that particular margin for you.
And that gets you about 80 to 90% of the way, sometimes even 100%. You'll click, it'll make a full margin line, and then you just go back with a little bit of adjustments yourself and kind of pull, and it'll adjust automatically.
Just by a click of a mouse.
And how long does that take?
Oh, a few seconds.
A few seconds?
Yes.
I'm looking forward to that today. We'll see how that works. And of course, the next step is actually designing the crown, and this is where we say hands off. I really don't want to touch it, but it's really easy to do that in Trio's Practice Lab. And Francis, why don't you explain a little bit about the options that the doctors have, or dentists should I say, to design their own restorations?
So in using this software, novice users can use it because you have so many different options where you can make your restoration seamless. So you do have the ability to use smile libraries that are provided by 3Shape, and then you can plug that in to your restoration. If you have a post-operative scan that you take, you can take that particular image and then just mimic it to your particular restoration once that margin has been set.
So you have the option, of course, of re-scanning the case, let's say right before you prep, take a scan of that actual unit you're going to take or the tooth, and then you go ahead and prep the case, and when you get into the design software, you can use that scan and actually mimic the same design or the same aesthetics that the patient had previously for patients that might want that. And then, of course, you have the option of pretty much matching adjacent teeth, which I know you didn't really talk about there, but I'm sure you're going to show us.
It's my favorite tool.
Exactly. You can match the adjacent teeth and it'll do all the calculations for you, or you can divide the arch in half, and let's say if you're doing a bicuspid on one side, you can match the bicuspid on the other side. There's just, and of course, the library you already have prefabricated, and the software does the calculations for you. You just click and play, which is pretty brilliant if you ask me. Now, of course, that brings us to one of the new features, of course, in 3Shape. I'm going to let you explain the articulation process. Please let us know what that's about.
Of course. So in the clinic world, we all know how important that once you do a restoration, the most important part of that restorative is the occlusion. We have an articulator that brings into motion, chewing motion and articulation definition. This way, when you finish your design, you know that you're having the maximum occlusion so that when you go to fit in that restoration, it's just perfect hands-on.
And I know for our viewers, you're probably looking at that and saying, wait a minute, the maxillary arch is upside down. Well, we were putting the file together and we're testing out the margin. We actually wanted to see the bite and the occlusion. And what this does is it shows that canine guidance and how the patient naturally chews and bites based on your impression and your bite registration when you take it with the intraoral scanner. And you'll see some occlusal marks where there's going to be some rough contact between the opposing and the actual tooth. And what you can do in those cases is actually adjust the thickness of the occlusion to be at a place where you have light contacts, medium contacts, heavy contacts, and save some of the enamel on the opposing tooth or dentition. Is that correct?
That is correct, just by pressing play.
Just by pressing play, automatic process. Of course, that brings us to the next step, and just to explain, normally, of course, I know dentists usually don't see this who don't have CAD/CAM setups, but there is a process which we would consider the same as printing out a file, let's say on your computer when you're in a Word document. You print it, it goes to the printer, and it comes out and you have a piece of paper with words on it. Well, in CAD/CAM, you get to the place where you set up your actual crown and you print it out on a CAD/CAM 3D machine. And this is that portion where you are combining the CAD software as well as the CAM software in the same platform, so you don't have to leave. But explain to us, as far as the milling process, how do they set it up in this CAM version?
So of course we've been discussing seamless solution and how important it is to stay in the same platform. So after you're done with the design, by clicking next, you will see that you bring up the inside of your actual DWX-4W. You'll see your design inside the block, and of course you can adjust this to what number of area in the block you want it to go to. And then just by clicking produce, it will start your machine right away.
So you click produce, of course you jump right into here after you've completed the articulation process, and all your contacts, you're going to have a warning that says, hey, if you have some contacts that are not there, and we'll see that in a second, you can automatically fix that. You jump into this phase, it plugs the unit or the design you have right in the block, positioned properly based on what slots you select, because of course you have those 3 slots to use. And then once you do that, it automatically mills by you clicking on produce.
Yes.
That simple. So that brings us to the next step, which is the Roland mill itself. Just a few pointers about our mill, and the DWX-4W is a wet mill. It gives you the option of loading up to 3 blocks at one time, which means you can get three jobs done simultaneously, or 3 designs. You can do 1 to 3 unit bridges, of course, and it comes with a 2-year trouble-free warranty. Now, most importantly, with our mill, you're going to get consistent quality results each time you mill. So you shouldn't have any worries there. And it's going to be pretty much either if the same or not better than the analog system that is there. We have a lot of good results. We'll show that to you later, but it's a very good option to use for your practice with the Practice Lab solution. That brings us to our live demo. So we're going to let Francis display just how easy it is to use the software. And Francis, why don't you go ahead and show us how to do that?
Of course. So as you see right in your screen, we already have the order form set up so that we do a crown on number 11 with whatever material you choose to use together with your machine in the DWX-4W. After we go into this, we can go next, and then we go into the scanning portion. So right away we can see that the scanning portion says to start with your lower. When I start my scanner, we're going to see how quickly and efficiently it takes the scan. So for this case, we're going to do a quick quadrant and then just flip that right over. And then we see how the pixelation and all the information is taken nice and quickly.
Now, I notice how you kind of went occlusal, then lingual, then buccal. Is there a specific way that you should scan each case?
Absolutely. We do have a recommended scan path, especially as for users that have been using our system, we've introduced them to insane speed. And in order to use that, you do want to make sure that you're focusing yourself on that particular scan path, because it's almost like a puzzle. You want to make sure that your scanner can get all the right information as it moves on.
Okay. And I noticed that you also just flipped the top. I know our users can see that you pretty much took the top of the scanner. Why did you do that, actually?
Correct, because you don't want to manipulate your hand too much, especially once you're being inside a patient's mouth. So just by flipping your tip over so that it's easy to still click on your buttons up on the top and then go inside the patient's mouth flawlessly, you can just go and start with occlusal. Let's get a little bit more information here. Then move into our palatal area.
Oh, that's pretty quickly.
Yes. And then from the palatal, we can bring ourselves on over. And then you want to make sure that all that information is being picked up. Now, once you go into your particular restoration and you have a lot of that definitive scan there, you want to make sure that you get into the interproximal areas as well. And then you can see how you can manipulate the scanner any which way to get that information.
And of course, this is a very high quality, I'm seeing image here. How many microns is your scanner as far as its productivity and crispness?
Yes, so we do have some information that calculates us as 8.9 microns.
8.9 microns, that is pretty good, I would say. I mean, you can see the image, so that means you're going to get almost all the details if nothing's really going to be missing there.
Absolutely. You're going to get speed and efficiency.
Oh.
As we see here, I've calculated number 11, and the software also states where you might need to get more information.
Oh, so that's where the yellow areas are there on the screen, if you can see your viewers today. So those are areas I'm assuming we have to pick up again and just make sure they're clear?
Right, but then because I have that particular scan path, it's going to be very nice and easy to get that information in between.
All right, that wasn't too fast. That was about, what, 3 minutes maybe,
Oh,
less?
yes, less. And then we can go straight into next and get our bite information. When you get the bite information, you're always going to want to flip it back to its original position. Okay, getting bite information, you want to start all the way at the back. And of course, you do get pop-ups stating how to bring your bite together. So you do get step-by-step that gets calculated. You can get rid of that.
Now, is there an ideal process for scanning the bite?
Absolutely. You always want to start all the way in the distal area, start your scanner, and then just bring yourself forward. And then if you saw, just 4 seconds, and it brings and aligns your information together.
That is pretty quick. So we just went through the scanning process of a quadrant, let's just say, in about 2 to 3 minutes. Set up a patient's case. Of course, that would take a little bit of time depending on your assistant. But the next thing we do is we get that information, we set, of course, the path of insertion and what tooth number like you did, and then we get into the design phase, and this is where the most interesting part comes. So let's just go ahead and jump into that and show us what do you have and what steps do you take to finish off the crown?
Of course. So then after we're done, if you notice, because we've set our annotation to number 11, it's going to bring us to model format. But we also have different tools where you can use model format and also back and forth to regular scanning. So remember, I also said that we have that automatic tool. What I do is that I can bring that scan nice and close up to me, click on one particular area, let go, and then it just brings it all into play for me.
So you're looking at that. I'm sure our viewers are looking, any dentists that are out there, you can see that pretty much is almost accurate. I'd say maybe a couple of things
Very
off.
minimal things that
But
I
you
have
said
to
there's some
change.
other things that you can do to actually see if you have it on correctly, right? I mean, like-
Correct. So what I love about the software is that if I wanted to get more intricate, I'm always going to have this particular guide that I can just click on and it'll move it on for me
So it kind of mimics what you're going to change, so you can make sure
before
you
I
wanna do
even
it.
do the change.
Brilliant. So we have the margin scan, or should I say the margin line. Margin line done in less than, I'd say, 30 seconds or less. Wait, it calculates for you. You can make an adjustment if you want to. What do we do next?
Okay, so after you've had that information, because it calculates anything that you've brought from the scan portion, also your margin, and then from there, since the software knows that it's going to be doing something in 11, it'll bring in our insertion direction and how that crown is going to come into play with your restoration.
Brilliant. And so we have the path of insertion so you can actually set it automatically. And of course, as Francis was saying, that's just the interproximal contacts and making sure that crown is going to go in precisely without causing too much friction with the adjacent teeth. And of course, now we've already went to the next step where it's pretty much designing the crown for us. There's no clicking going on. There's no buttons to press. We just click next and it goes ahead and creates a design. And go ahead and tell us what's going on.
Exactly. So once we click next, remember the software takes all the information from what it's populated and what you've given it, and it gives you different options. So as we were talking about before, we have options of different smile libraries that are going to be intuitive with what you have available for you in front of you. Something else that we do have available, which is my favorite tool of all, is our copy tool. So we noticed that if I wanted to utilize the copy tool, and here I have the opposing, I have an arrow down on my restoration and an arrow on the tooth that I want to mimic. We'll see a silhouette of the information I want to go ahead, get crossed over, and then we can see that the software just mirrors all the information just by clicking play.
So I can automatically match a tooth on the adjacent side, cuspid to cuspid, lateral to lateral, just by clicking on it after the design. It'll automatically mimic that tooth and get that design and grab it and pull it in.
Absolutely. And just like we were showing our viewers before, the articulator, we do have the articulator motion, and then different tools that you can bring everything together. And just to show them a little bit of that articulation, just by clicking on play and the information that it gives us.
Great, so you've got that, we've got the articulation, we see that the bite looks good. Of course, we can always zoom in to kind of check a couple of areas and see where it's red and where it's going to be very tight as the contacts are concerned. The next step, of course, I would assume is milling, yes?
Yes, absolutely. We click on next, it'll ask us to enforce any information that needs to be populated. It'll close up any gaps that needs to be closed up.
So that just pretty much fixed any type of thin material. Let's say if the occlusal was too thin or the lingual side was too thin on the wall, the thickness is automatically added in for you. You don't really have to manipulate anything.
You don't. And
Awesome.
then it brings in that particular design that you just restored and brings it right into your block.
So we just went through that process. We're already here at the milling phase. And you'd say, what, maybe 5 to 10 minutes max?
Yes.
Counting your patient schedule. So it's a real easy to use process, a lot of automated features. And that just brings us to a couple of other things. If we could get the slide back up here for you. What comes out of our mill, which is usually the quality that we're talking about. Here you can see a 2-unit bridge, pretty much molar and first and second molar, should I say. You have quality, you have the good, nice, round emergence profile. Your buckle is nice and rounded, and you can see that the margin is flush right against the bottom of that tooth. And of course, we have a 3-unit, should I say, onlay with a pontic in the middle. And normally with cases like this on a machine, you really wouldn't see this type of precision. You can see that the margin is, the line on the onlay is pretty flush against the
And the
tooth.
aesthetics are beautiful.
Not to mention that these teeth are actually outside of the model, so they're pretty much held together by the restoration. And that brings us to the next thing, materials that you can use on a Roland DWX-4W. Of course, any composite resin and glass ceramic will work. And glass ceramic is kind of a broad topic. You can talk about nanoceramics or feldspar ceramics. But basically, Vita Enamic Mark II, Soprinity, depending on which part of the globe you're in, Lava Ultimate, Emax CAD, Obsidian, GC Ceramart, and Celtra Duo, to name a few of them. Of course, there's a lot more, but as long as you stay in the category of composite resins and glass ceramics, you will be fine. And just to recap today, as we're running out of time, you have a seamless solution. You can go from start to finish, from first initial intraoral scan to the final restoration of printing it out on your own machine, chairside in your own clinic, very easy and very quickly. Novus users can design, correct?
Absolutely. We do encourage that clinicians use their assistants, and the design portion is very easy to use.
And of course, any dental assistant, or of course we want to keep the doctor working with his patients and getting people out the chair, so we always have the option of online training if you need some assistance, but the process is really easy to learn, and once you learn it, the software does the work for you. And of course we know multiple materials can be used on the DWX-4W as long as they're in that glass, ceramic, composite resin category, and you're going to get consistent quality results. So don't worry about the analog way things used to be done. You have a machine that can still get you those results, and we do have proven results to show you. That's it for today. I once again want to thank Francis Torres for coming out from 3Shape to be with us today for this presentation. It's been a privilege having you here.
Thank you so much for having me. It's been so much fun.
And we thank you as well for joining us today, sacrificing 30 minutes out of your time to learn about the solution. We hope that it will be a benefit for your practice and help you continue to get good quality results. Have a great day.
Bye.